everybody. We are having conversations about COVID with Dr. Eric Bush, who's the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care. Thanks, Dr. Bush, for taking a few minutes out of your day to talk about COVID.
Thanks.
So this topic, we're trying to cover 5 things that we should know. And today's topic is the data dashboard, the COVID data dashboards. And first of all, I'd like to find out what's the best source to find information about COVID-19 updates. What dashboard do you sort of guides you in your day-to-day?
Sure. So for me, the local one is the Maryland Department of Health and Mental Hygiene page. And depending on which state you live in, you can just go to Google and ask for your local state Department of Health or even your county, depending. But state-wise, that's generally the one that gives me the most information.
Okay.
If you want to look at a more global picture, there's also a couple of other indicators. Johns Hopkins has a website out there, and if you just Google Johns Hopkins COVID or COVID dashboard, that should bring it up for you, as well as another site called Worldometers Coronavirus, and that gives you a global picture to let you look at the numbers and where we are comparatively speaking internationally, just to give you some perspective on the breadth and depth of the pandemic.
So number 2 question would be, what numbers should we actually be focusing on, or maybe what categories should we be looking at when we're looking at a dashboard?
Sure. So there is a lot of important data there. One is the positivity rate. So the percent of people within your state or jurisdiction that have been tested within the last 24 hours, what percent of those individuals have been positive? Because again, the higher the positivity, the more the concern about the spread is. There's also additional numbers such as number of people hospitalized, and there are cumulative numbers there too, how many people have, unfortunately year to date contracted COVID, as well as deaths. And then here in Maryland, we actually have county by county breakdown too as well.
Mm-hmm.
So if you're somebody like me who lives in one county and works in another, it gives you some perspective on any differences there. There is also, since vaccination has begun, at least here in Maryland, there's also a vaccination piece to the dashboard.
Okay.
This divides the state of Maryland into 5 different jurisdictions, I believe, and it tells you what percent of those jurisdictions have been vaccinated thus far. So again, a lot of different ways to gauge progress and where we are and look at those numbers.
You mentioned, and this was my 3rd question or topic that we should talk about, the positivity rate. So what's something that we should really know or understand about the positivity rate? You see it on there, but what's it really mean?
Right. So again, positivity rate by definition is the number of people that have been tested in the last 24 hours and have what percent of those have been positive out of that total number of tests. Ideally, you want to see the positive. I mean, you'd love the positivity rate to be 0.
Right.
We haven't been there for a long time. But one of the things people talk about as a key indicator is 10%. And so if that positivity rate is 10% or higher, that's a concern that you may need more restrictions in the area, which are then going to impact on, abilities to get around and about and freedoms and things such of that nature. So that's one of the reasons why the positivity rate, and you want to know, here locally, is there something that we're doing or not doing that's making it better or worse than our neighbors? And how can we learn from each other to try to make things be the best that it can be?
Gotcha. That makes a lot of sense. So I think you mentioned this, but let me just clarify. My number 4 point would be to what pieces of data should we really focus on with regards to the status of the pandemic? So definitely positivity rate. It sounds like maybe hospitalizations as well.
Hospitalizations definitely, because you look at situation like California, where the health system is really under a lot of stress, and they're talking about things like rationing healthcare, which you never want to get to that point.
Right.
That's fairly frightening. And so you really want to look at that hospitalization percentage. You also want to look at deaths too, because we know unfortunately a certain number of people are going to die from this. And again, you want to see, is somebody doing something better or worse than somebody else that they can learn from, as well as year to date where you stand versus maybe other states or other countries. Internationally, those are all things that you can look at too and compare.
Right, puts it in perspective. Yeah, for sure.
Mm-hmm.
Finally, the last point that I think people might be curious about is, you see these numbers, how often should you really be tracking this? Is it important to look at every day? Should you wait once a week? Like what's your thought?
I think for most non-medical people, I think once a week is probably enough. I look at it every day. I try to look at only, certain times. Because if you look at it too much, then like any other data point, are you overanalyzing it? And if you look at it once a week, that's probably good enough to give you more definitive trends, see where things are headed to versus last week. If you look at it once a month, that's probably not frequently enough, and no more than once a day. It's not something you need to look at every hour or anything.
Right.
So.
Gotcha. Can get you too bogged down if you're
right. Exactly. Because obviously, like Dr. Fauci said too, this is the reality. We're living this. We understand what's going on. But I think it's good to put it aside too and think about other things at this point, just from a general coping perspective.
right. So be aware, but not sucked in, not
exactly. Not obsessed.
Right.
Not obsessed with it. So.
All right. Awesome. Thank you very much, Dr. Bush. I appreciate your time.
Great. Thanks, Tammy.
I also want to thank the John and Kathy Belcher Institute for their generous support of the community education programs for Hospice of the Chesapeake.